Hey there everybody, it is Dr. O'Gwyn here, and I want to talk about what are those knots that you get in your shoulder here. Get in the upper trap, you get them in the necks. Some people get them in the back of the shoulder blade, you can get them in your low back and the back of your hips. A lot of people want to know, what are those knots anyway? How do they occur? How do they come about? And most importantly, how do I get rid of them? So let's talk about what they are. There are a couple of ideas or theories of what they might be. The most commonly accepted idea is that there are these things called trigger points. So we'll talk about the trigger points first. What is a trigger point? To describe that, let's quickly talk about how muscles work, and it'll give you a better understanding. So I'm going to use my arm here to talk about how muscles move. Approximate or shorten the muscle, or I'm going to lengthen and stretch the muscle. We have hundreds, thousands of muscle fibers that slide past each other like this, and when these muscle fibers slide past each other going this way here, it's going to shorten the muscle, bring bones closer together. As they slide past each other going this way here, they lengthen or they stretch out there. To understand a trigger point, first think about what is a muscle spasm. A muscle spasm is when a large group, almost the entire muscle, seizes up. It gets into this spasm or contracted state. So they just all get very tight very quickly. It's extremely painful, but it's usually short-lived. You can stretch it out pretty quickly. A trigger point is something similar to that possibly, but on a much smaller scale. So instead of it being the entire muscle fiber, the entire muscle, it's a small group of muscle fibers, very, very small group of muscle fibers that kind of get in that contracted or seized up state. It is not as painful as a muscle spasm, but it can be very irritating, and because it lasts longer, it can start to cause referred pain. So you might get that trigger point right here, but it's going to refer all the way up into your neck, around your head. It can refer down into your shoulder blade. So these trigger points, although they're not as excruciating, as painful, they can be very uncomfortable, and if left there for a while, they can sometimes just get worse and worse. Let's talk about how they occur, why they're there in the first place. An interesting thing about these trigger points, so I said, is just this really tight spasm group of muscle fibers, small group of muscle fibers, but right around those muscle fibers that are in that spasm state, all of the other muscles are usually elongated, and they're usually weak. So they're not as strong compared to the muscles on the other side of the body, and they're usually lengthened. So how can that happen? Well, let's talk about our current everyday posture for most of us living in this culture. We're on computers all the time, we're on phones all the time, we're driving, we're just doing things with everything in front of us, and we usually get bad posture. Our shoulders roll forward, our neck comes out, so everything's tight here, pulling us forward. But then everything in the back here is lengthened. Those muscle fibers are lengthened, so they very easily get those little strains and those little contractions in those muscle fibers. So that's probably one of the most common reasons why you get those, but they can happen because of misjudged movements. You turn too quickly or sudden and you weren't ready for it, and that muscle kind of wants to fight and come back. So that can cause it. Picking up misjudged amount of weight, you do something too quick and your body just wasn't prepared for it, you can get those little trigger points in there. They're also related to stress, maybe not getting good quality sleep. So there are multiple reasons on why they might come about. But the most common one, I think, to understand is that muscle imbalance. That's something that absolutely has to be corrected. So I said there are two theories on what those knots might be. So that was one, the trigger point. Let's go over the second idea. It's a little bit more current, up to date, and they might both be true in just different situations. But another thing is something called a densification. So this isn't so much about what's occurring in the muscle as much as it is about the soft tissue around the muscles. So let's talk about what that means. We have something called fascia. Fascia is this soft tissue, this connective tissue that holds all of it courses through all of the muscles, holds all of these muscles together, holds the tendons, ligaments, muscles all collectively together. When you get a massage by a chiropractor or a physical therapist, they like to make themselves feel a little bit more special. So they don't say, I'm giving you a massage. They say, I'm going to perform myofascial release. Myo is muscle, fascia is that connective tissue, because we now understand that we're not only working on the muscle, you're also working on this fascial structure, this large system of tissue that holds everything together. So that's what the fascia is. Now, in order for that fascia to be able to move and flow and slide past all of the muscle fibers and the tendons and the ligaments, we need something a little slippery, something that is going to act like a lubricant. That something is called hyaluronic acid. So that hyaluronic acid, I think of it as the body's natural motor oil. Well, if that gets congested in a specific point within that fascia, called a densification now, that is going to cause kind of that knot or something that just feels like, what is that lump? What is that going on there in that muscle? It feels like it's in the muscle. It might actually be a densification. So how do you get rid of those? Well, similar thing, they probably occur because of strains and things going on in the muscle, so you really want to look for those muscle imbalances. Of course, that myofascial release that I talked about, it's just a form of massage. It just makes me feel better about myself to call it something else. I'm a glorified massage therapist when I'm getting in there and working on those muscles. But certain forms of kneading in there, sustained pressure for 30 to 60 seconds, moving people through ranges of motion as I'm digging in there. There are different techniques that can get rid of those. So that's one, addressing the muscle imbalances, finding where people are tight, showing them how to stretch it. I'm talking about before in this posture, most people are tight in the front here. They need to stretch their shoulder back. They're usually tight in here. They need to do certain stretches through here, and then they need to strengthen and exercise back here. So they need to be doing things like this here. So we got the muscle imbalances. You've got to correct those. Dig that stuff out, work it out through manual therapies. Acupuncture, specifically a form of acupuncture called dry needling. So dry needling kind of takes out a lot of the ancient philosophy of acupuncture and is more for a physical therapy kind of approach. So I perform acupuncture, I do a lot of dry needling. So we'll find those knots and put the acupuncture needles in place and then take them out. But what the acupuncture needles do will help bring more circulation and blood flow into those areas. So for some people, they find that beneficial. And then certain rehabilitation, there's something called strain, counter strain. There's proprioceptive neuromuscular facilitation, post-isometric relaxation. These are all really similar techniques. That means we take that muscle into a stretched position. First, you've got to find the muscle, though. Identify it and have somebody who knows what they're doing, put it in a stretched position, and then you can resist against them with a little bit of pressure and then relax. They'll take you into a stretched state again, and you do that several times. That can help break it up. So these are all the different ways to try to break these up and get rid of those. I hope that you found that useful and kind of try to sum it up very quickly on what those knots might possibly be, some reasons why they may occur, and then most importantly, some ideas on how to get rid of them. You could try massage, try the dry needling or acupuncture, but most importantly, you're going to have to do some form of physical therapy if they are reoccurring. So get the right stretches, the right exercises. And then one thing I almost forgot to mention, of course, as a chiropractor, when I find those knots, there are almost always joint dysfunctions or areas where the spine is restricted. Muscle dysfunction and joint dysfunction are almost always occurring together collectively. So I do a spinal manipulation or a spinal adjustment on those regions near where that trigger point is, and I can usually find where it's locked up. But we do that mobilization. It gets that joint freed up and moving again, wherever it is, if it's in the neck, if it's in between the shoulder blades. And that causes a neurological reflex to reset that muscle pattern. So the firing pattern of that muscle will be improved and the joint's not going to be locked up anymore. So that cannot be overlooked as a way to get rid of these. I have worked with people with these knots that they've had for days, and I can't move my neck here. And we do a manipulation, some soft tissue work, and it's, wow, I'm 80% better already. I can finally move that again. So hopefully this was helpful, give you some little advice on how to work those out. And as always, if you have any questions at all, leave a comment below. I'd be happy to answer any questions that you guys might have.